Let me ask you something important about your private medical practice. Are you grinding? Are you struggling for profitability? It happens with every practice almost across the entire United States, where these practice owners who are amazing caregivers and servants of the public are struggling to build a profitable practice. And you don't have to operate that way. If you're just running your business, running your practice, and you're just trying to survive from day to day, watch this video. I'm going to teach you about one of the most amazing things that is changing medical practices all over the country. AI and automation. And I've seen this over and over again. Like I said, medical practices are led by these incredible, amazing caregivers who, without fail, seem to be just drawn into the weeds and drawn into the chaos. But don't worry. Today, you're going to learn exactly the 7 most important automations that you need in your medical practice that's going to give you back time, freedom, and more patience. No more missed appointments, no more broken follow-ups, no no-shows. You'll get better referrals, all through systems. Remember, you being in the weeds, you being overwhelmed and exhausted doesn't have to be this way. In today's video, I'm going to break down these 7 automations that we've actually built and put in with multiple practices so you can finally start getting referral patients on autopilot, build loyalty, and actually live up to the brand that you already know you embody through your work. And no, it's not about replacing the human touch. It's about protecting it. So let's jump in. First, why automation isn't as cold as you might think. Most medical practices or practitioners hear the word automation or AI, and they think this is about them losing their personal connection with their patients. And that is wrong. And I want you to break that mindset of thinking. When you do it right, automation adds to the patient experience. It fills the gaps. It keeps people feeling supported, connected, and cared for, even when you and your staff are busy. This isn't about robots replacing humans. It's about building a practice where patient care doesn't fall through the cracks. So these 7 automations I'm going to walk you through that I recommend for every single private medical practice that we work with. Physical therapy, chiropractic, optical, mental health, dermatology, all of it. You need these 7 automations and it will improve your patient care, improve your referrals, and make your life easier. Number 1, automated intake and pre-screening. This one is a game changer. If you survey patients all across the country, one of their most frustrating parts of working with any private medical practice is the intake forms and the endless amounts of paperwork. And you know as well as I do, if they don't complete the paperwork and all their information or their insurance information or whatever it is, your system doesn't function correctly. Put all of that in a very simple automated system that they can do from their phone via text in the easiest way possible. That connects not only to your CRM or your patient acquisition system, also your EHR system. By having this functionality, you have already changed the experience from your patients and separated you from so many thousands of other practitioners out there. Number 2, appointment reminders. Don't send emails. Now, obviously send emails, but remember, emails at best have a 13 to 15% open rate. 13 to 15%, that's it. So I don't want you to just send emails. I want you to send text messages. I want you to use technology called ringless voicemails, where your doctors or your highest paid medical practitioners can pre-record a voicemail that reminds patients about your scheduled appointment. It creates actually more one-on-one connection from doctor to patient without taking the time of the doctor. This one automation alone cuts no-shows dramatically, and makes rescheduling painless, all while connecting the doctor and the patient relationship stronger than ever before. Number 3, after session check-ins. This is very important, and it's one of the most underused tools in any private medical practice. So after your session, a simple text message, maybe 1 hour or 1 day later, that says, "Hey, thanks for seeing us. How are you feeling after our session?" And it gives them the option to give one simple answers like better, same, or worse, or even with emojis. This little feedback can trigger different automations in your business. Like if they give a very positive or they're doing really well, you can immediately ask for reviews or referrals, all through automation. If they're feeling worse or not doing well, it can alert the front staff to reach out and help in new ways. Do you see how automations improve your patient care, not hurt it? It makes it better. Number 4, a referral request automation. Here's a secret. 96% of people have said that they will give referrals if they were just asked. Notice that 96%, that's nearly everyone. They don't think to do it unless you ask. So set up a very simple system, all driven through your automation, so that you're requesting referrals and giving them confidential ways or easy ways to send people to your practice. Right after something goes well, after a great session or a great meeting or a great injection, something that goes really well, keep it low pressure, keep it simple, and most of all, keep it easy to share. Number 5, birthday messages from your practitioner. Oh, this one is so great. It might seem small, but it is massive for patient experience and for patient care. When a patient has their birthday, and I know in your EHR system, you're already tracking their birthdays, simply have your doctors or your practitioners pre-record a birthday wishes message from them, and then use the automation to send a ringless voicemail on their scheduled birthday. Imagine that patient that just gets that personal happy birthday wish on their voicemail from their doctor, from their optical provider, from their therapist, from their dermatologist, you name it. That is such a personal connection, and it requires no additional time from the doctor, just simply recording the MP3. This one is a big one. Number 6, re-engagement message. If someone hasn't booked with you in 60 days, stop waiting for them to come back. Just send them a simple automated text message, or even better, a ringless voicemail, asking them how they're doing, about your openings, and encouraging them to come back. Stop waiting for the right time and start making the right time through systems and automations. Number 7, requests for testimonials and reviews. Social proof matters. And when care is done well, which I know you're already doing, and the time is right, ask for feedback. Remember, we all worship at the altar of Google, and you want Google reviews like everybody. So when you do your job well, ask for reviews, ask for testimonials. And I recognize this can be sometimes difficult in particularly sensitive medical practices. So it's hard, but it doesn't mean you don't have a system that asks for it. Because when they start leaving those reviews, you'll rank better on Google, and it will reward your practice with patients, I promise. The reason this worked is because it makes your practice systematized and automatic. Remember, one of the reasons we at Accountability Now even work with so many medical practices is because most providers and practitioners didn't go to business school. You went to med school and you got different types of training. We got training in AI, automation, scaling the business, and working with medical professionals just like you. That's why it matters to work with the right types of people to help you build your practice. When your systems are messy, your patient care suffers. When your time is wasted, your impact shrinks. Getting these systems in place is a game changer for your practice. And that's why you should use tools that are HIPAA compliant, like our CRM, Engage 360, which you will be able to see in the notes below if you want to take a look at it. But it helps you automate and use AI throughout your whole practice to free up your time and put these 7 functions in place in the very easiest way possible. Remember, in the future, great care won't just be personal, it will be predictable. And that predictability, that kind that builds trust, reduces stress, and keeps people coming back month after month after month, all starts with AI and automation. And if you're running a private medical practice and you feel like you're just spinning in circles, you're not alone. You don't have to be that way. Get better systems, get better tools, get better support. Put these 7 automations in place in your practice. Use the right tools and watch how easy success can be. And even if you do it on your own, whether you use a service like Accountability Now or do it yourself, don't wait. Your patients deserve automation and AI and consistency. So do you.